On May 23rd of 2016, a man was driving his truck to work on Highway 65 when a school bus pulled out in front of him. This man did everything he could to avoid hitting the school bus. He swerved and slammed on his brakes and ended up hitting the end of the bus, which caused to throw his truck across the road and turn it around, smash the windows out, and push his steering wheel up against his seat. His family received one phone call saying that he was being taken to Cox and that he was coherent and he was in an accident. That's all that they had heard. This is how I learned about complex regional pain syndrome and how it can change your life. What is complex regional pain syndrome? Complex regional pain syndrome is a chronic pain condition most often affecting one of the limbs, your arms, legs, hands, or your feet. Usually after an injury or trauma to that limb is when this becomes known or appears. It's not something that you can find on just an MRI scan or going to get an x-ray or a CT scan. It's very undetectable. This CRPS is when your central nervous system is composed of the brain and the spinal cord, and the peripheral nervous system involves nerve signaling from the brain and spinal cord to the rest of the body. And basically what happens is your nerves don't respond to your brain, and you constantly are having pain and a burning sensation sent through your body, causing your affected limb, like your leg, not to heal, to swell up. Can't use it, it won't function. It basically becomes dead to your brain and it forgets about that part of your limb. Anybody can get CRPS, men or women. It's more common in women than it is in men. Children don't get it under the age of 5, and it is not common in children 10 or under as well, but it can happen. It mostly happens in adults around their 40s is when it gets discovered. Some of the symptoms, or I guess we've already talked, some of the causes of CRPS is it can happen literally doing anything. You can bend over, pick up a piece of paper, you can be moving furniture, get in a car accident, a burn or a scratch. It literally just happens. It's kind of like an allergy that goes undetected. And it just happens so fast that it just happens that fast. There is no for sure treatment plan for CRPS because it's not even detectable as of right now, and there hasn't been a lot of research done on it. This particular case, it took 5 months before he was even diagnosed with CRPS. Nobody could explain what was going on, and we were told that it was a unique case. Some of the treatments that have been effective but don't create a long-term cure is rehabilitation therapy, exercise program to keep your painful limb or body part moving, constantly having blood flow to it. There's several different medications that you can use that will manage the pain for you but doesn't take it away. Some of those drugs are opioids, Oxycontin, morphine, hydrocodone, non-steroidal anti-inflammatories, botulinum toxin injections, sympathetic nerve block, which is where they put a nerve block in the affected limb and it stops the nerve signaling and the pain, but you have to constantly get a nerve block put in. It does not have a long-term effect. You can do some other neural stimulations and psychotherapy. You go see a therapist that helps talk you through this. CRPS can affect your life traumatically. You get angry, depressed. You have to reinvent who you are because you may not be able to walk. So if you have a career that requires you to climb ladders or construction work or be on your feet all day, or if it's your arm that you have to use all day long, it definitely can affect your career. It can affect your everyday life. You may not be able to take out the trash or mow the lawn or make yourself some food, drive to work, or anywhere else. It causes you to be angry and depressed. You can also get PTSD from if you were in a traumatic experience. This also affects your family a lot because, you know, they're trying to help you and they don't know what to do to help you because you yourself don't understand what is going on. This disease is called the suicide disease just because nobody understands, nobody knows what to say or how to fix it, and they say that it's in your head and that you're making it up the whole entire time. The man in the beginning of my story is my father. Our life has forever been changed since May 23rd. He found a doctor who specializes in it, but he may not be able to walk for another year. Maybe. If not, he's having to decide what he wants to do for the rest of his life, and it's a long process. We're very thankful that he's here. Majority of my information has come in from doctors and different appointments that we have gone to and therapists and just listening to them talk, as well as I got some more information from the Mayo Clinic. If you would like to look it up, just type in what is complex regional pain syndrome and we'll give you a whole list of what it is. And just to show you a picture of what my dad's truck looked like, that is the front of it. And definitely want to bring awareness to this disease because there's not enough out there and a lot of people are affected by it.